My name's Robin. Thank you for having me. I definitely enjoyed my time here in India. I've been asked to tell about what I've learned here. And like I was saying, it's mostly cultural differences that I've seen. For a good while, I didn't know if the head shake could mean no as well, because I would ask a question, it was a yes or no answer, and they would only shake their head, and I was like, but is any of that no? Like, just, you could just tell me. And it took a while. I had to ask someone if it only meant yes, and it only means yes or okay, which is nice to know. Everyone dresses so nice, like no matter what. I feel really bad. All the clothes that I brought weren't as nice. It's nice for me in Alaska, but I always felt like a slob next to everyone else because they dress so nice. Literally in everything, in the autos, in the restaurants. I'll have to work on that. But medications wise, it's mostly that they're packaged differently. In the US, we do pills individually, and in India, a lot of them are packaged as a pack, and more or less in aluminum, and you cut them out and then you give it to them. Here, or in the US, we do a lot of recounting and then putting in a new bottle and then putting in a new label. And then there's a lot of rules on what the labels say and things, so it's different in that sense. And then in the pharmacy, in the hospital, I guess, we do a lot of, it's all electronic health records, so we do checking renal status and checking if it's the right antibiotics, and it's usually streamlined pretty fast because it's all on the computer, and we complain a lot on how slow the computer is. But in India, you know a lot of your medications and your guidelines off the top of your head way better than we do, because while we're on the computer, we can also have the guidelines open. So I think how you process everything is a lot faster in your own individual knowledge, more than we can process it with our computers. And then I think I enjoyed, Dr. Siddhartha walked me through a lot of cases and how it's normally treated versus how this patient got it, and I really appreciated that. And then Dr. Shiva also went through a really nice case with me, and then showed me the immunizations and such, and I appreciated those. I think feedback, it would be nice to talk through the medications more on those cases, or on other days when I didn't have them, because like the doxycycline with lactobacillus, it's the same medication, but in the US we don't have them combined between the two. It's one or the other. And that's what I want to learn is how is the medication different in India? And I think it's more or less just talking through the individual medications. So I enjoyed my entire time. I definitely appreciate